Hi, and welcome back to the channel. Today, we're diving into something that might shock you. The state everyone thinks of as a paradise has become ground zero for America's addiction crisis. What if I told you that in Florida, getting addiction treatment costs more than most people make in an entire year? And that while 3 million Floridians battle substance abuse, the treatment system might actually be making the problem worse. This video will give you the real numbers, the hidden truth, and what's actually being done about it. So let's get started. Florida's addiction crisis is massive. We're talking about 1.7 million people struggling with alcohol addiction alone. That's 8% of the entire state. Add opioids, cocaine, meth, and marijuana, and you've got over 3 million Floridians battling addiction. To put that in perspective, that's more than the people that live in Chicago. But here's the kicker. Last year, Florida recorded 7,831 overdose deaths. That's a 37% increase from the previous year. And suicide now exceeds homicide in 90% of Florida's counties. This isn't just a drug problem, it's a full-blown public health crisis. So how does Florida's treatment system actually work? The state has built an entire industry around addiction recovery, 847 facilities spending $401 million annually, treating nearly 60,000 people every year. Cities like Delray Beach and West Palm Beach have become recovery capitals with specialized facilities, sober living homes, and extensive support networks. It sounds great, right? But there's a dark side to this boom that nobody talks about. Let's talk about what this actually costs. The average residential treatment program in Florida, $56,640 for just 30 days. Now, Floridians' median household income is $73,311. That means the average family would spend 77% of their entire year's income for 1 month of treatment. Want specialized care? LGBTQ+ affirming treatment costs $70,000. Luxury facilities can run $100,000 for 1 month. Meanwhile, 40% of Florida adults report anxiety or depression symptoms, but 25% can't access the mental health care they need because of cost. This isn't healthcare, it's a luxury service disguised as a medical treatment. So who's getting hit hardest by this crisis? Alcohol addiction affects men more, 60% versus 40% in women, but opioid addiction is almost evenly split between genders. Here's what's really telling. People under 25 in Florida earn $20,000 to $30,000 annually. Even peak earners aged 45 to 64 make $50,000 to $80,000. At those income levels, even 1 month of treatment would consume most of their yearly earnings. And there's still a gender pay gap. Men earn $40,000 to $50,000, while women earn $30,000 to $40,000. So women face both income barriers and additional treatment access challenges. What's driving this crisis? 4 major factors. Geography. Florida's location makes it a hub for drug trafficking routes from South America and the Caribbean. Tourism, the transient population, and party culture create high-risk environments. Economics, when treatment becomes a profit center, facilities have incentives to keep beds filled rather than focus on long-term recovery success. Demographics, an aging population with prescription drug access, combined with young adults seeking party drugs, creates a perfect storm. Now, let's talk about what actually works and what's affordable. Outpatient programs cost just $1,400 to $10,000 for 3 months versus $56,640 for 1 month inpatient. Faith-based programs average $50,000, with some offering free treatment entirely. Dual diagnosis care ranges from $5,000 to $30,000 depending on mental health integration. Medication-assisted treatment, highly effective for opioid addiction, but adds 15 to 20% to the cost. The most effective treatments aren't always the most expensive, but the system doesn't always make that clear. Despite the challenges, Florida is pioneering some innovative approaches. The state's year-round climate allows for outdoor therapy programs. Recovery communities provide extensive peer support networks. And some facilities are proving that effective treatment doesn't have to cost a fortune. Outpatient care is showing excellent results at a fraction of inpatient costs. Sliding scale payment programs are making treatment accessible, and insurance advocacy services help people navigate coverage options. Recovery is happening every day. The key is making it accessible to everyone who needs it. Florida's addiction crisis reveals a hard truth about American healthcare. When life-saving treatment costs more than most people earn, we're not solving the problem. We're creating a two-tiered system, but there is hope. If you or someone you know is struggling with addiction in Florida, help is available. SAMHSA National Helpline 1-800-662-HELP 4357, free confidential 24/7 treatment referral service. Florida Department of Health substance abuse resource with sliding scale payment options. Crisis text line, text HOME to 741-741 for immediate support. You're not alone, and recovery is always possible, regardless of your income. Thanks for watching. If this opened your eyes to Florida's hidden health crisis, share it with someone who needs to see it. Subscribe for more deep dives into America's healthcare challenges, and let me know in the comments what shocked you most about these numbers. Stay informed, stay safe, and I'll see you in the next video.